Okay, so we had discussed all these topics regarding research. Um, we talked about what quantitative and qualitative research methods are. And next, it's just a summary of what we had talked about research already. So if is my screen visible to everyone?
Yes.
Yeah, thank you. Okay, so
Yes.
yeah, thank you. So what your main objective is, it is to to identify the main trends and issues. So if you're talking about an issue, let's say you're talking about child health, you want to see what are the main issues that are coming up within child health. Sorry. So, and these issues are with regards to anything that you would want to talk about. So it may be obesity, it may be excessive screen time, it may be improper nutrition, anything. So you just want to identify what issue is happening at the moment and what are the problems that you are observing. So you would want to write a sentence describing each issue that you've highlighted. Then you want to keep track on how often each of the main findings appear. This is known as the prevalence or the incidence. So how common is this problem? You're talking about obesity, you might want to talk about adult obesity, you might want to talk about childhood obesity. So how common is it? How common is it globally? Where you're coming from? Probably you're comparing that with the UK, whatever. But you want to see or you want to keep a track of how often does it happen. Make a list of your findings from most common to the least common. So what's most common if you're talking about research in child care, or if you're talking about research in teens? What's the most common problem and what's the least common problem? And how would you know this? Through research. And how are you going to do that? You're going to find that out online. And then you evaluate a list of the strengths, weaknesses, opportunities, and threats that have been identified. So you see what strengths do you have? What if you talk about a research topic, what strengths do you have regarding that research topic? Are you working there, or do you have enough funds for working on that research project, or you have enough staff that will help you on that research project? Now, I'll just give an instance of my research, the next research that I'm planning to do. I teach at the university. So I'm a full-time lecturer there. And I teach physician associate students. It's an MSc course at the University of Bolton. So what I do is when I'm teaching them, I'm seeing different strategies that help me and help my students the most in teaching them. So how is teaching going to be inclusive? So one of you had said, I'm not sure who said that, person-centered care. So I'm talking about student-centered teaching, so or student-led teaching. So one of the ways I'm doing that is through an anatomage table. So I teach anatomy. So like teaching them through slides, PowerPoint slides is okay, but we have an anatomage table at the university, and that can show you dissections of the human body. So if you want to see the carotid artery, for instance, or you want to see the heart, for instance, so it shows you very minute details of the heart, which you would see if you were dissecting a real human body. So it's like a table, and it shows you it shows you how to dissect a human body and how to get into the heart of the human body without actually using human beings, which is obviously hard, not possible now. We used to do it years and years ago. So I want to see how this has helped students in strengthening their concepts in the topic that we are teaching them. So and why is this important? So I am making teaching more inclusive. I'm including students. I'm engaging them in different ways. I'm not just giving a PowerPoint presentation. I'm using different media to teach them. So this is my strength because I have an anatomage table. I have staff who's agreed to work with me. So this can be any strength that you have. What is my weakness? I don't have the time. They rush through the topics because it's the whole human anatomy, physiology, pathophysiology that they have to cover in the first year with their placements. So I lack time with them, and I teach only once in a week. So that is also a problem. What are my opportunities? My once in a week teaching. Or I can make more opportunities. I can ask more for more lectures with them and then conduct that research. What are my threats? Well, the other staff members, they might not want me to work on this anatomage table because it's just new and it's very, very expensive, and they would want people who are very experienced and who know how to use that table because it has a software. So I might just go around playing with it, and I might not work properly on it, or I have students who will be working on it as well. So the students might, I don't know, there might be some incident that could happen. So that is a threat that I have. Just think about these things. What strengths, weaknesses, opportunities, and threats do you have when you're talking about your particular research? Then you prepare conclusions and recommendations about your study. You act on the strategies that you've developed. Look for gaps. Now, how would you look for gaps again? Through this research that you did. Okay. So you're seeing what has been done and you're seeing what has not been done. The anatomage table, I know it's never been done in this cohort of MSc students. It might have been done in previous students. They might have had a go with it, but these students definitely, they've never seen it. Review the results and consider efficient methods to analyze and dissect results from interpretation for your interpretation. Is that clear to everyone?
Yes.
Yeah. Okay. I keep giving my examples. You can give your examples. Please chip in whenever you want to. Yeah, just make it an interactive session as much as possible. I'll appreciate that. Thank you. What is research in health and social care? So health and social care research, it aims to find out new knowledge that could lead to changes in health treatments, policies, or care. Now you're working in a setup. I'm not in that setup. So I'm in education, basically. It's higher education, but where you are coming from, you have a say in policies. You could have a say in policies, in care, or in health treatment. So this is why you're specializing in health and social care. So what is it about? We've talked about this yesterday. You would want to diagnose diseases earlier or more accurately with this research. You would want to provide life-changing treatments, prevent people from developing conditions. As I said yesterday, prevention is always better than curing. Improve health and care for generations to come, ensure everyone has a better quality of life. And there's a great deal to do. There are still so many questions that need answers. Sometimes what research you do, it confirms that we have at the moment the best available to us right now, and we don't have, this is the best we could do. So this is what your objective should be in this research. Okay, so clinical research, there's certain research topics that we can discuss now. So there are certain clinical research trials. So they focus on finding and testing of new drugs, medical devices, or medical treatments. So for instance, developing a new test for breast cancer. So you could see the previous tests that were done, and now you want to see a new test, and that your objective here is to prevent the progression of breast cancer. So you want to prevent the progression of breast cancer so that you don't have to let that patient suffer from chemotherapy or from surgery or from radiotherapy. And then your one research topic would be to compare two medications or drugs to treat heart disease to see which one works better. So you're treating patients with one drug and then you're using a new drug. Now, please be aware that there's a lot of ethics that is concerned with these research topics. So one ethics concern could be that you're trying a new test for breast cancer. How do you know that if you're treating these people or you're testing them for breast cancer, that you would be able to treat these people, but you're not treating the other lot? So, or for instance, if you're comparing two tests for breast cancer treatment, so how do you know that which test is the best? Because obviously you want to give the best to for your treatment. You can't just say that, okay, I'm giving no treatment to one group and I'm giving this treatment to the other group. No, you can't. That's unethical. In the same way, when you're treating two sets of patients with heart disease to see which one works better, which drug works better. So in this instance, just to be aware that the ethical concerns that you would have here are that if you're using the best drug, what about the other group? Why are they not getting the best drug? So that then you're using a new tested drug. So that's been tested already, but it's new in the market. You're using that drug and then you're using on another set of patients, you're using another drug that has also been tested, but that was used previously. That also saved people from heart diseases, that also saved people from death, morbidity, and mortality. But you're seeing what's the difference. So you're giving the best to both of them, but you're treating one group with a new best thing and the other group with an old best thing or the previous best thing. So this is a short film to see how research helps. I'm just going to copy and paste this. You can see it when you are free in your own time. So it just says, because of copyright issues, I can't really go ahead and show you this. It is a YouTube thing, but yeah, you can have a look at it right after the session if you want to. But it says basically what is the importance of research in today's world, when everything is so new and everything needs updating. Is that clear to everyone, this session? Yeah, I hope that's clear. I'll start talking about our next learning outcome, which is learning outcome 2. Just a minute. Okay. Everyone's quiet. Is everyone okay?
Yes.
Yeah, okay, that's fine. Now, coming towards our next learning outcome. So this is unit 5 again. We are talking about research in health and social care. The second learning outcome is how do you identify and justify a research topic within services for health and social care? Now, that's the biggest question today. Identifying a research topic might be easy for some, it might be hard for some others, but the hardest bit I would feel is to justify your research topic. So how would you do that? So your indicative content here would be considering the potential impact of your research. What if you don't work on this topic, and why haven't you worked on another topic? So is there a bigger impact of your research compared to any other research that you would do? Or is it more feasible for you to consider this research compared to any other research? We'll talk about ethical considerations, preparing or developing a timeline for research, presenting potential evidence-based practice study. We'll talk about the aims and objectives and the reasons, understanding and methods for conducting the research project, permissions, approvals, consent, confidentiality, anonymity, understanding your research purpose, aims and objectives and needs for accuracy and focusing and time. time management, recording and reports and analysis. So what's the importance of research? We've talked about this earlier. Okay, so this is there. We know why we are doing research. It's basically to diagnose diseases earlier, more accurately, provide life-changing treatments, prevent people, from developing conditions, improving health and care for generations to come, and ensuring everyone has a better quality of life. Again, if it's coming up a lot, that means it's important. So, I've shown you this research proposal earlier. I'll show you the same research at the end of this lecture. So what is evidence-based practice? So as the name suggests, it's a practice that comes from evidence, that comes from already known evidence. So for years and years, people have been working in the healthcare sector, trying different ways in order to prevent disability in people. So evidence-based practice is basically a process used to review, analyze, and translate the latest scientific evidence or scientific research. So what your goal here is to quickly incorporate the best available research along with clinical experience and patient preference into clinical practice, so that if they're nurses or if they're any other clinicians, they can make informed patient care decision. So evidence-based practice is the cornerstone of clinical practice. So whatever we do, it has to be evidence-based. We can't come up with our own stuff. Whenever we are doing research, we need to, if I'm using an anatomage table, how do I know that it's been helpful before? Or how do I know it will help my students? The reason is because I'll be doing a literature review and I'll be seeing if it has helped students before. And if it's not helped them, I would want to know why hasn't it helped them? And then I would want to work on those weaknesses of previous research, and I'll develop my own strengths in that area. So evidence-based practice requires that decisions about healthcare are based on the best available, current, valid, and relevant evidence. So evidence that was there in, let's say, 2019 when there was COVID-19, that doesn't help now. So they're different now. There are new decisions that have been made and new guidelines that have been developed. Okay, so how do you get involved in evidence-based practice? This is when you're working in a team and there's several professionals that are working within your team. So there is an inquiry or there is a question that you have, and you reflect. Has anyone learned how to reflect? Do you know what reflection means? Anyone?
It means to look back at what you did and think about it so you can improve on it, and think about what you did wrong so you don't do it again.
Yes, that's reflective practice. Very good. Anyone else? Have you ever worked on reflection, or have you ever done any reflection in whatever you're studying or whatever you are doing? Okay, so reflective practice is very important. It's basically practicing and questioning your practice. So if you're, for instance, if there's a medication that you've tried in a patient, you reflect on the question, or you reflect on what you've done already at the moment. How have you given that medication? How have you interacted with the patient, for instance? Or what dose have you given to the patient? You reflect back on everything that you have done. So sometimes it's hard to reflect on everything, obviously. Then you have a checklist of what you have done, and then reflect on each and every component that you have done, or whatever main components you think need reflection. You then think about what is there in evidence, and that should translate into your practice and then help you to reflect again. So it's a constant cycle, which then leads to best practices. Okay, so that is how evidence-based practice works, because evidence is at the core. And then your practice would lead to practice, your best practices, whatever you'll see or whatever you'll do will lead to practice improvements. And then you will reflect again. And then there'll be a question coming again. Okay, I hope that's clear. And you do it as teams also. So what are ethical considerations? So in research, I've just informed you a bit about what ethical considerations you could have in different research topics. So they're very important to consider because they will come time and again. So this includes voluntary participation. So whenever you're involving any person in your research, they need to participate on a voluntary basis. It is not a forceful contribution or a forceful volunteering from their side. You need to inform them about what is going to happen in the research, and they need to give their consent after being informed. Okay, that consent could be verbal. They could say, yes, we are happy to be a part of your research. It could be written. They could sign it, or it could be both. So a verbal and a signature. Anonymity. So I'm working with students. The students wouldn't want to know that if they've given a bad comment about my research, they would not want to know that it was themselves or what the name of the student was, just because they might fear for the consequences with me. I'm just giving an example. I wouldn't do anything wrong with them, obviously, but anonymity always helps you to give better answers to a question. Or whenever you're taking data, it is always good to give them the option that they can remain anonymous if they want to. Confidentiality. So whatever they will share, all their information will remain confidential. There is no harm in being part of the research, and the results would be communicated to them. So when they're scientists and researchers, they always adhere to a certain code of conduct when they collect data from others. These considerations protect the rights of research participants and enhance research validity and maintain scientific integrity. It is very important to have rigorous research, otherwise there's no use of research. Research ethics matter for scientific integrity, human rights and dignity, and collaboration between the science and society. So talking about research, we need a timeline. Again, a timeline is very important, because if you want to do research now, it should be valid to be done now. As I said again about COVID-19, the whole world now knows what COVID-19 is and how would you prevent yourselves? What are the signs and symptoms? So there's nothing new that you would want to add. So a good timeline. So if you want, if you're starting your research now, you would want to give a timeline of when you would complete the research. Obviously, if you're taking 2 weeks time, like now, you would want to report what you are doing in your 2 weeks time. So for instance, in your first week, you will work on your literature review, on your background of your research, on your aims and objectives. And in the next 7 days, you would want to work on other bits. So timelines, make it easier for you and for us also to understand the historical events related to any subject in an orderly manner. So when you have a timeline, you would want to include starting and end date of your project and important milestones. And you would want to use a reference to the events that you include in your timeline in your project description. So this is an example of a timeline. Just have a read of it. So there are weeks given over here. There are a lot of weeks given over here. We have just 2 weeks and just few hours. And these are the different tasks that can be done. So obviously you include your vacation here if you're doing it a long one. Is that clear? So you would want to give a timeline, or you would want to prepare a timeline for this, for your research also. Just take a picture of this. You can take a snapshot of this.
Are we doing this in a month instead of 3 months or 4 months, aren't we?
No, you just have 2 weeks for this.
2 weeks. Okay.
Yeah. Mhm.
It's a month from now though. Because we've got,
It's no. It's I have one more session with you.
and then it's
and
2 weeks
that will
from
happen.
then.
Yeah,
Okay,
that's
so it's 3 weeks.
yeah. That's
Okay.
Saturday that I'll discuss. It's actually next Sunday that I'll discuss the assignment with you.
Okay.
And yeah, and from there you will have 2 weeks then.
Okay, thank you.
You're welcome. Oh, why is this so big? Okay. Just a minute. That's okay. So I'll just read this. Okay, this is better. Okay, so when you're doing your research, you would want to present your evidence-based practice study. So here there are some steps where you would want to go through. So you will, for instance, you will start with assessment of the patient. So start with the patient, determine the critical clinical problem or question that arises from the care of the patient. Then you want to ask a focused clinical question, construct a well-built clinical question derived from the case. Then it's acquiring evidence to answer the question. This is through literature research, literature review. You would want to appraise the quality of the evidence. How important is the evidence that you have gathered? How recent is it? How good are the studies that you've included? Apply the evidence to the patient care. Return to your patient. Integrate the evidence with clinical expertise and patient preferences. Apply it to practice and evaluate the patient's outcome and your own performance. This does not apply to all of you. So this is just an example of the steps that you would want to do in evidence-based practice if you're working with clinics in clinics with patients. This is just an example. So it's not important that all of you have to do this. So again, now we want to explain the importance of aims and objectives. So what is a research aim? There's a difference between research aim and objectives. So an aim is a broader term. It shows you what your main purpose or your goal of your project is. And by reading your aim, I would know what you are going to do at the end of your research project. So sometimes a research project is explained as a broad statement. So for instance, in my research project, my aim is to understand how learning happens best in physician associate students, for instance. So I'm doing a practical bit with them and I'm seeing how did it help the students in understanding the anatomy, physiology, and pathophysiology of diseases. Do they learn this way better or do they learn better with PowerPoint presentations instead? That could be your aim. So your aim should include 3 parts. So there are different questions that your aim could see. So why is the research necessary? What is the purpose of this research and how will you accomplish it? Okay. So there's a difference between objectives again. So the research aim defines what your research is going to answer, but your research objectives outline how is it going to answer it. So this gives you how, the how of the research. So those you could break down your objectives into smaller portions. So this will represent a key section of it. Each portion will have a key section of the project. Okay, so each of your research objectives should have these things. So it should be specific. It should be on a specific population. So you're not going to have the entire population. If you have children, talk about children. If you want to include the ages of the children, let's say 4 to 14 years old, whatever your age range is. Accessible. So what method are you using to measure your progress and determine? So how are you going to assess your research? Sometimes this is used as measurable also. So sometimes you want to measure how will you see that your progress in the research project. Then achievable or obtainable. Do you have the necessary support, resources, and facilities to execute the project? Or will your project just be done without any support? That's impossible, isn't it? So you would require some support. Is it relevant? Does the action you propose support the achievement of your research aim? And is it time bound? Are you realistically able to complete the action within the given time frame, which is 2 weeks time? Or if you want to start from now, is it going to complete in 21 days? That is a question that this is SMART, measurable, achievable, relevant, time bound. Sometimes we use SMART objectives. Okay, so these are very important to understand whether you're going to in the right direction or not. So what is the difference between aims and objectives? So an aim focuses on what your project proposes to achieve, and objectives focus on the how bit of the project. The research objectives are more specific than the research aims. The objectives focus on the shorter term and immediate outcomes of a project, while aims focus on its long-term outcomes. It's best to write an objective as a numbered list, and research aims can be written in one sentence or a short paragraph. I'm just okay, so it's just 2 or 3 slides more. That's okay. So ethics. We've talked a bit about ethics, and it's an understanding of the nature of conflicts that arise from moral imperatives and how best we may deal with them. So it's again, you might not even be asked about certain ethical concerns that arise from your project, but it is your duty to have them written, have them in your mind, and communicate that these will be the the ethical concerns that you could have in your project, and how would you deal with them. So midway in the project, you might deviate from that, and you might decide on, okay, it's easy to do it this way, even if it has certain ethical considerations. But remember, whenever you are doing research, or whenever you are treating or dealing with patients or anyone, it is your duty. You are responsible. You are the one who is at the forefront, and you would be there answerable. So if you might not be noticed now, but if that becomes a part of your practice, you would be noticed somewhere. And then probably if you want to submit your research somewhere for, you could even think of this, of submitting your research as a publication. It will be questioned there if there are any ethical concerns. Okay, so always be aware of these ethical concerns. So there's different guidelines that have been developed, that and ethics, they have the basic principles revolve around autonomy. So every patient or every person who's being a part of your research has the autonomy to leave at any time of your research. They're not inclined to complete your research with you. Non-maleficence means that you will prevent harm as much as possible. So there's no harm. Beneficence, do these patients or do these people have any benefit of being a part of your research? And then justice is very important. Okay, so this is again a SWOT analysis. Just have a read of this. We'll talk about this in your next session. So this is again strengths, weaknesses, opportunities, and threats of your research project that you would want to see. There's a handout that has been shared with you. It should be on Moodle 2D1, which shows improvement, knowledge, and skills. So have a good read of this. We'll talk about your research project in your next class, and we'll talk about the SWOT analysis that you have developed. So these are some of the references that you would want to have a look at. Any questions that you have, learnerwork@ukversity.co.uk is the place to reach out. And that's it from my side. Any questions on this topic? I'm
After this session, can I edit my question and do it just for well-being instead of well-being and development? Because I don't think I can do both in the amount of time that I have.
Yeah, I was thinking of that. Anything, yeah, that's not a problem. I would appreciate if you could share your research plans or your topics with me. I'll stop sharing here. I'll start sharing the proposal again, just so that every day when we go through whatever we are going through, we know what we are doing. Yes, Jessie, that's perfectly fine. Just let me know what you're changing, how you're tweaking it. And yeah, I'm have a look at it. Yeah.
Please, concerning the LO1, the learning objective one for the research,
Yeah.
are we going to get the variables? Are we going to get the variables ourselves?
The recordings.
The variables for the research.